Okay, I'm going to talk about how changes in the partial pressure of carbon dioxide are sensed and communicated to the central and the peripheral chemoreceptors, and how they, in this case, will work together to bring about the appropriate ventilatory response, which is going to be to increase ventilation in response to increased levels of carbon dioxide, or decrease ventilation in response to decreased levels of carbon dioxide. An important feature to point out is the fact that there is a blood-brain barrier which segregates the central chemoreceptors from the peripheral chemoreceptors, and most of the constituents in this reaction, the reactants and the products, are impermeable to the blood-brain barrier. This is not true for carbon dioxide, which is a diffusible gas that can freely diffuse across the blood-brain barrier. Because the other reactants are impermeable to the blood-brain barrier, there exist two parallel equilibrium reactions between carbon dioxide and water and bicarbonate and protons. In a situation where carbon dioxide levels increase, perhaps due to a decrease in ventilation, due to like breath holding or increased CO2 production, this is going to lead to several effects, all of which are going to promote ventilation. First, from the blood side, the increase in the partial pressure of carbon dioxide is going to cause a rightward shift by the law of mass action to promote an increase in the production of both bicarbonate and protons. The increase in the production of protons is a decrease in the systemic pH. Both the decreased pH and the increased PCO2 are going to be sensed by the peripheral chemoreceptors of the glomus cells, which are going to relay that information to the respiratory center, promoting an increase in ventilation. The central chemoreceptors are going to indirectly detect this increase in the systemic partial pressure of carbon dioxide, because when carbon dioxide increases in concentration, it will cause it to diffuse down its concentration gradient across the blood-brain barrier into the brain interstitial fluid. The increase in the movement of carbon dioxide into the brain ISF causes a rightward shift in the parallel reaction on the brain side between carbon dioxide and water, producing bicarbonate and protons. This means that there will also be a decrease in the pH in the brain ISF. This will be detected by the central chemoreceptors. And the central chemoreceptors will respond accordingly by promoting an increase in the ventilation. So we will ultimately have three separate factors promoting an increase in ventilation. We will have the decrease in the systemic pH by way of the peripheral chemoreceptors, an increase in the partial pressure of carbon dioxide, also picked up by the peripheral chemoreceptors, and a decrease in the brain interstitial fluid pH, which will be directly sensed by the central chemoreceptors. Conversely, if we have a decrease in the partial pressure of carbon dioxide, perhaps due to hyperventilation or decreased carbon dioxide production, we will see the opposite effect for both the central chemoreceptors and the peripheral chemoreceptors, each promoting a decreased rate in ventilation. So on the blood side, quickly, the decrease in the carbon dioxide will be detected by the peripheral chemoreceptors. That will promote a decrease in ventilation. The decrease in the carbon dioxide will cause the blood pH to increase, right, as a decrease in the proton concentration. That will be detected by the peripheral chemoreceptors. And then on the brain side, the decrease in the carbon dioxide concentration in the blood will cause a net movement of carbon dioxide out of the brain ISF, thereby shifting the reaction leftward and promoting an increase in the pH in the brain ISF. This will be detected by the central chemoreceptors, which will promote a decrease in ventilation.